Joe for a second with you. Okay. I welcome you. Good afternoon. Welcome to the June version of the CDC, DSTDP, ASTDA Prevention Science Series lecture. Gives me tremendous pleasure today to introduce to you Dionne Gesink. She's not here for the first time. Those of you who are long-timers, like myself, may remember her being here about 10 or 11 years ago. Is that right? Oh, 17, she was. Okay. All right. It happens with age. I'm delighted to have all of you here as well, because I think we are in for a really sweet experience here. Dionne comes to us from the University of Toronto, where she's an associate professor at this time. And she brings to us a very interesting interdisciplinary formation. Her earlier education was all in geography at the University of Toronto, and her PhD is from the University of North Carolina in epidemiology. And I thought I always do all kinds of levels and relationships and the individual and the group and the population, etc. But I'm going to read to you the way she described her approach to her science. Her research focuses on the social epidemiology of sexual health using mixed methods. She works from a relational paradigm and is particularly interested in the patterns, connections, and relationships between social, cultural, behavioral, environmental, and spatial factors and health. And last night we had a very interesting intellectual conversation, and she explained to me that she's going to bring psychology into all of this, which is something I have never been able to do. So I'm going to watch her career with great interest from now on, and I think you're going to watch her speak with great interest today. Dionne, thank you.
Thank you, everyone, for being here. I know I'm in competition with another very important presentation. And so I really appreciate you taking the time to come and listen to the work that we've been doing in Toronto. It grew out of the syphilis epidemic that we have there. I just want to start, though, by acknowledging that this is not just me. There's a lot of us involved in this. There are several students who've helped with the data collection and analysis, and then my co-investigators have been really pivotal in being the sounding board for some of these ideas, and because I'm not sure, it's sort of a new way of thinking, I think, about networks and syphilis and STI transmission. And so they've sort of helped me refine my thinking and make sure that I don't say anything that's too bad or too outlandish. The really outlandish stuff is probably because I've forgotten to filter. But anyhow, so it's a collaboration between people at the BC Centre for Disease Control and St. Mike's Hospital and the University of Toronto. And at U of T, it's me and a few of my colleagues in public health and some colleagues in social work, and one in geography. So we know that there are syphilis epidemics happening in every major urban center around North America. And I've got the rates for the United States here below. You can see that, I mean, you guys know this because this is your data. The epidemic, there was one in the 90s, it waned, and then we've got the second one that started after 2000. And it's very similar in Canada, where we saw this spike go up in around the year 2000 as well, and it's just steadily been increasing. And I want to take a moment just to say, I hope you guys appreciate, and the rest of the states appreciate, how good your data are, because for sexually transmitted infection data in Canada, it's not that frequent and it's not that comprehensive. We get maybe 4 provinces that report at the national level. So we don't have that same real comprehensive understanding of what's happening across our country as you guys do here, and you guys get it out so quickly. I think if you were to try and Google STI data for Canada, you might find a 2008 report for the whole country. So hopefully we'll get to that point where we're pretty good by province, but we still need to work on our national level data. So I'm going to talk a lot about Toronto, and some of you may know Toronto, some of you may not. So just to orient you, it is a 14-hour drive north of here in Canada. We have a prime minister. This is our prime minister, Justin Trudeau. We have a couple of famous Justins. This is the one we're really proud of. It's him at Pride last year. We have 2 seasons, winter and construction. It does somewhat warm up enough for Pride, which will be at the end of the month, this month. And as the weather gets a bit warmer, we wear a little less clothing. And so it opens up our opportunities for sex a little bit more also. In fact, you can see it's actually really interesting to see what happens in the fall when people can actually see what was underneath the parka. So Toronto in 2015 reported the highest annual infectious syphilis rate in over 11 years at 49 cases per 100,000 men, with 50% of the cases also being co-infected with HIV. So if you look at, there we go. I have to be careful with my hot corners here. If you look at the overall rate for Canada, the overall rate's at around 11 cases per 100,000, so Toronto is quite a bit higher than that. Toronto is the 4th largest city in North America, so and we have a very large MSM population. So it's, I guess, not so much of a surprise that we would have a very high rate, if anywhere in Canada. That would be one of the places. In 2015, the infection was predominantly in the downtown area, the highest rate around here. Just to sort of orient you, there are roughly 2.5 million people that live in sort of the downtown part of Toronto. And in the greater Toronto area, we're closer to 9 million, I think, or 5 to 9 million. Yonge Street here is considered a zero line. It sort of splits the city between east and west. And from a sort of socio-cultural perspective, historically, there hasn't been a lot of crossing that boundary. Although there has been, with the condification of Toronto along the lake, there's been a lot more mixing between east and west, but it's definitely a east end, west end kind of phenomenon where people wonder if they need a passport to cross Yonge Street. Bloor Street is also another major road. Both Yonge Street and Bloor Street are where the subway are also. So from a transportation perspective, they're kind of 2 key roads. So the village, or the predominantly gay neighborhood, is sort of in this area here in downtown where the bright red concentrated part of syphilis was. That's where the prevalence of MSM, or the population, is the most high historically. But it's also an aging population. It's gotten too expensive for the young people to move there, so there's been Queen West is another major road, and they've been talking about the queering of Queen West, and now it's called Queer West. So that's where a lot of the younger and more mainstreaming gay population is. And then there's also City Space, which is where a lot of the condos are, and that's where a lot of the really young gays are living. And they talk about using the apps just to run between floors to have sex and find partners and stuff like that. And if you're in a different building, sorry, that's too far away. So we did some work earlier, before 2015, to look at defining a core area for syphilis, which we found in that same spot, the same downtown core area, where if you lived in that downtown core area, your relative risk for syphilis was 12 times higher than if you lived outside of that area. And then we also found 2 outbreak areas to the east and west, and 1 to the north. And so things haven't really changed that much. A lot of our resources have been targeted to the core area, and so there's this question of why is syphilis not going away if we are targeting everything to where we think syphilis is. And so I started to have this idea that, well, maybe what's happening is you've got the guys in the core, they're getting the education, they have the hassle-free clinic, which is technically hassle-free to get tested and treated. There's the Maple Leaf Clinic, which also provides a lot of testing. They're an HIV care provider. So I think guys in the core might be getting infected, but they might also be getting treated more quickly. So they're getting diagnosed quicker, they're getting treated quicker. But guys who live outside of this area here, outside of the core area, who are gay or bisexual, they aren't getting the same education. They don't have the same access to treatment or testing facilities. And they may be coming into this core area looking for sex and getting infected and not realizing it and moving back out, or like returning to their homes and staying infected and then reinfecting with, the next weekend when they go in. They may be reinfecting the core and sort of having this sort of oscillating perspective. So the question then became, well, so what is actually happening though? Like, we don't know what these mixing patterns are. So we decided to go into these areas and look at the geography of sex. So what's really happening? When I think of geography of sex, in my mind, it's you have an individual and their sex partner or partners. How do those people interact and with each other, and how do they interact with their environment, both independently, so me with my environment, my partner with their environment, and then both of us with our combined environment. So the purpose of our study was to study the spatial relationships between sexual partners and their environments for gay and bisexual and other men who have sex with men in Toronto. And the idea was to use the results to inform response to the ongoing epidemic, and by better understanding syphilis, potential routes of syphilis transmission and other STIs. So just to further explain what I mean by local environment, so each person or partner has their independent geographic location and immediate surroundings that I would consider the local environment, so where I live and my neighborhood. This will provide the context for me as an individual, my social surroundings, my environmental surroundings, and how those factors might impact my ability to transmit an STI or acquire an STI. So my local environment is going to influence the availability of sex partners, the prevalence of STIs, whether I'm in an urban or rural setting, whether I have access to STI testing and treatment, or even condoms can make a big difference. So if we think about the village, if I live at Yonge and Wellesley, this is my environment. So I can feel pretty comfortable if I'm a gay man. I can feel pretty comfortable walking down the street in my thong. And I know I'm going to be safe, and I know that the Hassle-Free Clinic is around the corner if I have any concerns. If I live out in the suburbs, now just imagine that picture, those guys walking down this street. I don't think you're going to see it. It's going to be a very different experience. So if I live out here, I'm not going to feel so comfortable walking down the street in my thong, especially in the middle of winter. So seasonality may also have an impact. My combined environment, then, is the geographic area between and including each sexual partner's local environment. And this, if we look at the combined environment, it allows us to explore how partners interact with their environment in the context of a sexual relationship. And it can provide some insight into the sexual dynamics. So who's traveling to who? What's the difference between partners? How far am I willing to travel? And where am I going to actually have sex? And what does my sexual network kind of look like in a spatial context? So again, if we go back to, this is sort of a zoomed in picture of the village. If I live in the heart of the village at Church and Wellesley, and my partner also lives in the village at Carleton and Jarvis, and we have the Hassle-Free Clinic just over on Gerrard and Church, I'd say there's probably a good chance that we're both getting tested pretty regularly, and we're part of the community, and we're interacting in a way that is probably different than if we both live out in the suburbs. This would be Scarborough, which is in the East End, and if one of us lived in one of these high-rises and the other lived further away, or one of us lived at Church and Wellesley and the other lived out in Scarborough, the way we interact might be very different. And just what we each bring to the relationship might be very different. One of us would either have to use transit or the car. Again, this is sort of an overview of Toronto so you can see it a bit better. The village is over here and city space is over here. So if I'm an older gay man and I live in the village and I pick up a young guy who's living in city space, this is maybe a 20-minute bike ride, 45-minute walk. Could be lovely in the summer. In the winter, I'm breaking it off. Like, this is not sustainable. So, it's too cold. Okay, so we used the mixed methods approach. We designed an embedded mixed method study design, which really was predominantly an in-depth interview with guys. We asked them how they found their sexual partners. We asked them to map their egocentric sexual network. We asked them about their sexual risk-taking and their STI knowledge. And then at the end, we asked them to fill out a very brief quantitative survey that had your typical demographic questions on it, but also their app use, so which sites they were on, their previous STIs, and their STI testing history. Okay, now for this talk, I'm gonna focus predominantly on the mapping piece. The other parts of the interviews are still getting analyzed, but I'll touch upon them because we used a lot of the information to sort of flesh out the mapping component. And I understand a lot of you have been taking a network class the last couple of days, so you probably know more about networks than I do at this point, and so we'll work through this together. But this might be a familiar image to you. This is often what we talk about when we talk about a sexual network map. You have these nodes and these arcs or lines or relationships, and this would be more what I would call a sociocentric network, like the whole network, how everybody's connected to each other, versus the egocentric network, which would just be one person and their partners within that larger sociocentric network. So normally that's what you would see. That's not what we did. Instead, what we did is we mapped the egocentric sexual network. So we took this guy, but rather than just sort of having these dots, we actually geolocated each of the participants. So we have our ego, which would be the star here in the center, and then each of their partners would be these yellow squares. So we mapped the participants' residence, that would be the ego, their partner residence, which would be the alters, and then where they had sex the first time. And we also asked them where they met, and we kind of divided them into met their partner online versus in some physical space. And so this is just an example of one of the participants, but what you can see is there are solid lines and dashed lines, and the solid lines are people met in person, and the dashed lines are people met online. Okay. So we purposefully sampled a diverse group of gay and bisexual and other men who have sex with men. Our recruitment strategy, we advertised using social media, the dating and sex-seeking websites and geosocial networking applications. We had a really great research assistant who was a very handsome gay man who used his picture and profile on all of the different apps and essentially lured in men and then told them about our study and asked them to participate before he got kicked off the sites. And then we also we used the email databases of organizations who were very invested in MSM health and the MSM community who were willing to assist with recruitment. This was especially important for reaching non-white men. And we also used word of mouth and then posting flyers in coffee shops and bars and sex shops and community poster boards around the city, and especially concentrated in the neighborhoods that were essentially considered sort of very gay-friendly or the village. We also monitored our response rates. I've been told maybe monitoring isn't the best word to use in a public setting, but we balanced out the response rates. We watched by neighborhood to see where our participants were coming from, just to make sure that we were getting both core and non-core people, and also the sort of urban and the more sort of suburban or local environments around the denser downtown core area. We also sort of watched by sexual orientation, so gay, bisexual, discrete guys, and race ethnicity, so that we didn't just get all 30-year-old white men. We wanted to make sure we got more than that. So also by age, and then also by recruitment strategy. We didn't want to get all of our guys online, so we made sure we got some guys that were not found online. The inclusion criteria were you had to live, work, or socialize in Toronto or the Greater Toronto Area. We actually ended up having 2 guys from the States participate because they would come up from New York and spend their weekend in Toronto because this was the biggest community that was local to them. The men needed to identify as gay, bisexual, two-spirited, or a man, just any man who has sex with another man. They had to be adults, so we didn't have to worry about duty to report and disclosure and stuff like that. Also because syphilis is more burdened in the adult community as opposed to the teen community. They needed to be actively or passively seeking male sex partners, which reveals my own sort of perspective on this, because a lot of my the men that were on the research team, especially the gay men, were like, what do you mean by passively looking for sex? And I was like, when you kind of go to the grocery store and you just kind of run into somebody and something happens, they're like, yeah, that doesn't happen for us. It's just active. There's no passively finding sex partners. Okay, so they also needed to be comfortable talking about sex. So our data analysis for what I'm talking about today, we had the in-depth interviews. We did a spatial analysis of the egocentric networks and also a bit of thematic analysis and quantizing of the data, of the qualitative data. And for the in-depth interviews and for that little small quantitative survey, we used basic descriptive statistics because our N is 31, so we're not really doing high-end stats analysis, but we did do a little bit of stratification that you'll see later. And then the integration part was we took we combined the egocentric spatial analysis with the thematic analysis to produce these archetypes, and then we used triangle plots which are also called ternary diagrams to explore it a bit further. And then we also combined the egocentric spatial analysis with the survey results to characterize the archetypes that we found. That's the quick run through of what we did. So in terms of results, so we had 31 men respond. The overwhelming majority of them were gay men or identified as gay men. There were a couple of bisexual men, and we didn't really have anybody say that they were discrete. They just, it was predominantly gay and bisexual. Their partners ranged in the preceding 3 months from 1 to 10 or more partners. We capped it at 10, but there were some guys who said, okay, which 10 do you want? And although we didn't ask the gender of their partner explicitly, they told us about their male partners only. So that's one thing just to consider, that some of them may have had female partners, but we didn't capture those partners. The average number of partners was about 6, the median about 5. 70% found their partners online, and they traveled anywhere from no travel to 25 kilometers for sex. On average, overall, it was a little over 3 kilometers. And there was some out-of-town travel as well. So for our analysis, we predominantly sort of focused on partners within Toronto, but there were some people who had a partner in Vancouver or in Brazil or other places. And so we just counted those ones outside of the Greater Toronto Area as out-of-town with a count number. Let's see. And then about half the participants were white, and the rest were non-white. Predominantly, we had Asian, mixed race, Black, and a couple of people just didn't respond to the race question. Canadians don't usually like to talk about race a lot. And then we had one Native American or First Nations. In terms of STI testing, this was a fairly highly tested group of men. 87% had been tested in the last year for STIs. 23% had syphilis in the past. This is self-reported STIs diagnosed. So 23% had a previous diagnosis of syphilis, 13% for HIV, 32% for gonorrhea, 29% for chlamydia, 13% for herpes and HPV. So the maps of these egocentric networks. I'm going to show you what we found were 6 initially. There were hosters. We categorized them into hosters. So hosters had all their sexual partners came to them. They essentially had sex at their home, and that was at least 80% of the time or more. Usually it was more. Usually it was about 100% of the time. So this is an example of what a hoster looks like. This is one of the participants. You can see the dashed line is a partner met online. So most of the partners were met online. A couple of partners were met in person. This hoster did manage to go to a partner's house. So the blue lines are when sex is at the individual's house. Orange is when it's at the partner's house, and green is when it's at a public space or place, like a bar or a park. So this one, over 80% of his partners he had sex with at home, so we called him a hoster. Then there were house callers, and the house callers only had sex or predominantly had sex at their partner's house, so 80% or more of the time they had sex at a partner's house. Rovers only had sex in a public space or a public place, 80% of the time or more. And then there were what we call privates. They were kind of a blend of hoster and house callers. So some of the time they had sex at their house, some of the time they had it at a partner's house. Neither was a dominant, you never reached an over 80% scenario. And likewise, travelers were a mix of house caller and rovers. Some of the time they had sex at their house, sometimes it was in a public space, but they never hosted it at their house for some reason. So you might think maybe a traveler, maybe they have a partner at home, like a husband, or a parent at home, and they're still living at home, which is entirely possible in the Canadian context. And then there were the geoflexibles who were happy to have sex anywhere. They could host it, they could have it at their partner's house, they could have it at the park, at the bar, wherever. So the first three, the hoster, house caller, and rover, kind of were the ones that we initially found, and we kind of thought, oh, okay, that's great. And then the biostatistician on the team, he said, oh, I think we could make a ternary plot, like it's a three-sided plot to look at this, which is what this looks like. So you've got your hosters on one corner, your house callers on another, and then the rovers on another. And these gray lines are 20% lines. So a house caller who has 100% of their partners or 100% of their partners they had sex with at their partner's house, they'll show up on the vertex here. So you can see 6 participants had that. For 80% of the time, they're going to fall on this first gray line. So 80% of the partners they had sex with at their partner's house, but there was 20% of their partners they actually had sex with in a public space. So we didn't really want to say that they were a traveler, but it was close enough. It was high enough that we decided to call them a house caller. So then this would be the 60%, 40%, 20%, 0% of the time. And it goes the same kind of sending out from each of these vertices. So this would be the 80% mark for hosters and then 80% mark for rovers. Okay? Yeah. Yeah, so a hoster has sex at their house. They host sex, and that's it. Like they have all their partners come to them. A house caller has sex at their partner's house all the time. A private is a mix of the two. So as an example, these two guys here that fall on this spot here on the line, they're falling between 80, 40, 60. So they're at 50% of the time they're having sex at their house, and 50% of the time they're having sex at their partner's house. Okay. So and then the geoflexibles kind of fall in the middle. The travelers fall on the spectrum between rover and house caller, privates between rover and house caller. And then we saw that there was nobody falling along this rover-hoster line, and we were like, oh, okay. So we didn't observe it, but does that mean it doesn't exist? And so the biostatistician on the team is also a psychiatrist, and he was like, I think it might not exist. I think that if you're willing to have sex in public, then you're willing to have sex at your partner's house. So I don't think we're ever going to actually see this type of person, because they would be somebody who would only have sex at their house or in a public space. So one of the working thoughts is that you could almost draw a line that bifurcates from house caller and transects this line here, where it's sort of a question of you are increasingly private or increasingly public in your sexual encounters. And so we may not end up seeing this 7th archetype. And we'll get back to what my theory is on the 7th archetype in a minute. We did want to check to see, okay, so do some of these archetypes exist in the core versus non-core areas? Like, can we start to sort that out? So we split it out between the two, and I've got it into 2 maps here because just to try and, I don't even know if this is showing up very well, but the answer is no, there's no difference. Like, there is no, you don't have hosters just in the core area, you actually have hosters all over Toronto, and you have rovers all over Toronto and house callers all over Toronto. You have all the different archetypes are everywhere. They're not just in the core area, which actually then kind of makes sense on why we're not stopping the syphilis epidemic. If you have this very centralizing hoster who exists in the core and out of the core, then you have somebody who's really kind of potentially spreading more everywhere. So then we decided, okay, well, can we characterize, like, can we see any very, I mean, this is very preliminary, right? Because it's 31 guys, and we've got a couple of guys we've got 3 guys in the hoster group, 3 guys in the rover group, 8 guys in the house caller group, 8 guys in the geoflexible group, and everyone else is in between. But we thought, but if we can see something, then maybe that's something, because our numbers are so small. So we'll just check and see if there's any way to start profiling this. What we saw is that hosters had a lot of partners. All of them, all 3 guys, had 10 or more partners, whereas the rovers, they had a lower number of partners. They averaged 4 partners. And these are the 2 groups that had syphilis, which we'll see in the next slide. These are the only 2 groups that had 100% of the men in these 2 groups had syphilis in the past. So what else can I tell you about these guys? Hosters met almost all of their partners online, whereas rovers met none of their partners online. And travelers met a lot of their most of their partners online, but privates not so much. So we're starting to actually see that maybe there are, in fact, differences between these different archetypes in terms of how far somebody's willing to travel. As you might expect, hosters were really not willing to travel. Their median distance was 0, so they're not traveling. Whereas the rovers went about, a median of 4 kilometers. Travelers actually went pretty far at 5 kilometers. Geoflexibles, I would have thought that they would, since they're willing to have sex anywhere, I thought they would have the highest travel pattern. They have the second lowest. They're almost like hosters in terms of how far they're going to actually go. And in terms of out-of-town travel, hosters they're not traveling. They are not traveling for sex. They're not. And nor rovers, actually. So even though rovers travel for sex, they're not traveling anywhere beyond their neighborhood, because they actually have a 5-kilometer. Their universe is about 5 kilometers, which makes sense to me because in Toronto, my universe is about 6 kilometers. Because my work, my house, my grocery stores, my socializing, it all happens within a 6-kilometer radius. We're kind of a lot like Chicago, where we're lots of different neighborhoods all pulled together that are defined by different ethnicities and stuff. Okay, what else can I tell you? So, yeah, and then as far as the out-of-town travel goes, even though the house callers had the highest number of out-of-town travels, most of them were not that far, about 200 kilometers, and the privates too, they only really just went to the suburbs, versus the travelers and geoflexibles were traveling more like to Atlanta. So we've got some differences there. In terms of age, it's hard to say for sure, but I mean, we saw some difference where travelers were younger, hosters were older. The other thing is by race, 100% of the hosters were white, whereas only 33% of the rovers were white. So we're starting to see some suggestion that there are differences in race ethnicity as well across these different groups. In terms of who's been tested for STIs in the last year, 100% of the hosters and 100% of the rovers have been tested. Same with travelers and geoflexibles. I think this might have been a group of men that were prone to testing, and conscious of their health, which is probably why they were participating in our study. Whereas house callers, not so much. They were not tested as much. And then when it came to syphilis, it was 100% of the hosters, 100% of the rovers. The only other group that had a little bit of syphilis, history of syphilis, was the geoflexibles. It's also those 3 groups that had a bit of HIV as well. But all groups had gonorrhea, and not even most groups. Some of the groups had a history of chlamydia, a little bit of herpes, very kind of limited HPV. Now, this is again self-reported and diagnosed. And actually we had a few guys self-identify with crabs as a concern, which apparently used to be a big concern before manscaping came into being. So it's all changed now. Okay, so that's the summary of what we saw for each of them. And then just to give you a little bit of insight into some of the top notes of what the thematic analysis is that we're doing right now. In terms of sexual partner seeking, we found that the guys were pretty habitual and they picked sustainable, whatever method was very sustainable for them. So most participants had 1 or 2 at most strategies for finding sexual partners. They would only change that strategy out of necessity if some kind of challenge arose, like a time constraint. There was one guy who was like, I am married and I have my lunch hour, so I can only meet guys online, and I have an hour, whatever's within like 2 bus rides or a bike ride from my work, and I can fit in within an hour. Online apps were the predominant strategy used to find partners, and the distance a participant was willing to travel was defined by their mode of transportation. So again, this guy talking about the subway or the bike, because those were his modes. Some guys would only walk, that kind of thing. And then the notions of distance, so the relative notions of distance, were strongly influenced by the density of gay and bisexual men in their community. So a guy in the village might think 4 blocks is too far, whereas a guy out in Scarborough might think 4 blocks is so close, they'd get super excited about it, because they could maybe even think about walking there. In terms of safety and risk, most guys protected themselves using condoms, but other guys talked about relying on their perception of risk, whether or not they thought the partner was risky, whether they thought the situation was risky. They would use risk reduction strategies as their way of protecting themselves, and they trusted that their partner would disclose their risk if there was any. And actually another thing a lot of them said was that it was a lot easier to negotiate or talk about STIs online. A lot of them actually advertised their HIV status already on there, and it was a lot easier to talk about if they had any other infections or when they had been tested most recently or that kind of thing online before they actually met in person. They also negotiated different acts. They also negotiated usually they used the term emotionless sex, so it was sort of like a no strings attached sex that they would negotiate before they even met, and then some of them would regret that, because once they actually met the person, they would be like, oh, but I kind of like this guy, I would like a relationship, but they'd already negotiated that away, so very few men recognized the risk of oral transmission of syphilis or any other STI for that matter, and very few used any kind of condoms for oral sex. We talked about the online. They identified trust as undefinable but central to negotiating sex and minimizing risk. And they relied a lot on in-person strategies like intuition and nonverbal communication as well. And there was definitely this complex intersection between power, intimacy, trust, and sex that we're still looking into. In terms of what they knew about syphilis or other STIs, so we asked them, like, so what do you know about the syphilis epidemic in Toronto? And they would say, what? There's a syphilis epidemic in Toronto? Why don't we know this? And we'd say, okay, well, what do you think of it? And then they'd say, wait, so that's still around? I thought syphilis was gone. Isn't that a really old disease? And we say, yeah. And then they'd say, isn't it curable? And we'd say, yeah. And they're like, yeah, it's just an inconvenience. It's kind of a nuisance. That's it. But HIV. And then they would start talking all about HIV. So they don't really know a lot about, overall, they don't know a lot about syphilis or any other STI, but they know about HIV. So HIV predominates all the conversations about STIs. Their HIV knowledge is actually pretty good. I think that's because of the historic gravity of HIV, that it's made other STIs look pretty trivial and easy to treat. So therefore syphilis really is not perceived as a concern. They had difficulty knowing the difference between syphilis, gonorrhea, and chlamydia. And they were not able to name any symptoms for syphilis or know about the epidemic. Okay, so now back to the archetypes. So in terms of conceptualizing these geosexual archetypes, with the hoster, the thought behind them is that hosters have this sort of centralizing force. They prefer not to travel very far for sex, and they find most of their partners online and have partners come to them. So they themselves their sex environment is highly localized, but their partners are more dispersed. So they're actually, in some ways, they've actually got this very potentially broad combined environment with their partners. They might actually have a very large catchment area since most of their partners are meeting online. So in my mind, they would have the potential to spread STIs widely. So even though there were fewer hosters and they had this centralized sex environment, they had a higher number of partners, and those partners could be widespread, so geographically, so they could spread it out quite a bit more if they become infected. House callers, on the other hand, they had more of a dispersing force, where they either can't or don't want to host sex at their place, but they are willing to travel a little bit further for sex. And so there's not going to be sort of anything locally for them. It's more about their partner's environment that you're going to be thinking about. And there were a lot of house callers, like there were 8 of the 31 were house callers, but they had a lower number of sexual partners. So lower number of partners, more of them traveling further. And this included out-of-town travel. And they found a lot of their partners online. And so how you might intervene with a house caller might be very different from how you intervene with a hoster. So they might be responsible, if they became infected, for a slower but more distant transmission, maybe. And then as far as rovers go, they're like the local boy. They don't travel very far for sex. They travel, but not very far. And some of these might be sex workers also. So they prefer to meet partners in person, and they have sex in public places or spaces. So there were very few rovers, and they had local travel. But they all had a history of syphilis. So you have sort of a very localized effect there. Versus the privates, who are the combination of hoster and house caller. So they have this highly localizing force, but very private. So they keep sex local, except on rare occasion where they might go out of town to the suburbs, where out of town means the suburbs. They're willing to meet partners in a variety of ways, in person or online, but they want to have sex in private, so their place or their partner's place. So they might be responsible for more local spread and some bridging between the downtown and the suburbs. And then travelers, who are the mix of house caller and rover, they travel the furthest, including out of town, and they have sex at their partner's house or in a public place they'll have sex anywhere as long as it's not their place. And they prefer to find their partners online, and they have the potential to bridge people and places between core, non-core, and suburb and more distant areas. So they have a pretty dispersed sexual network. And then the geoflexibles, they selected their sexual partners both in person and online. They had many sexual partners in the preceding 3 months. They had sex anywhere, so their partners could come from any of the other archetypes. And they were willing to go local or global for their travel. They didn't go too far into the suburbs, though. So they kind of create this dispersed local, global sex environment. And they have the potential to bridge the most subgroups, because both people and places, because it was the geoflexibles who were like half white, half black, or half non-white, and they would go local or global. They would have sex at home, at their partner's home, in some other place. So they kind of got around the most. So in terms of if you were to sort of say, okay, if these are archetypes within, these are egocentric networks, how do they fit together within the larger sociocentric network, and can they connect to each other? Who connects to who? So this is sort of based on the rules or observations that we've just talked about. You kind of get this web happening where there are certain archetypes that are not going to be able to connect with each other. So a hoster will not meet another hoster because you have to have sex at home, and so they're not moving. So they're never going to encounter each other, really, or it's going to be a rare day when they encounter each other. And a house caller is not going to meet another house caller because they're not going to have anywhere to have sex. So the rovers, they have a place to have sex, but neither is willing to move. The house callers, nowhere to have sex, willing to move. House callers and rovers are probably not going to encounter each other either because the rover will go and have it in public, but the house caller wants to have it in private. And a house caller and a traveler will not likely connect either. And a rover and a hoster will not connect. So the two groups that had a history of syphilis are actually never going to meet each other because one has sex in private and the other has sex in public only. They're not going to connect. But they will get linked potentially by those geoflexibles. So the geoflexible will bridge the rovers and the hosters. And then a rover and a private are not going to connect either. And then as far as archetypes that might encounter their own other archetypes, so if they meet a partner, a rover might meet another rover, and a traveler might meet another traveler, and a private might meet another traveler, and a geoflexible another geoflexible. But the rest of them won't encounter each other. So that's sort of, I guess, let me just finish this off and say that's as far as we've gotten in the thinking. But I think as you start to think about these things, it sort of suggests that you actually might have simultaneous epidemics happening in different subgroups of these men. And that's also why we're not getting on top of this syphilis epidemic, because it's impacting different groups within sort of the umbrella term of MSM. So the seventh archetype, we've decided to name them tentatively sirens. Sirens meaning like the sirens that call in the sailors and into their doom on the rocky shores. So these would be the people who are part rover, part hoster. So they're like a roving hoster, and so they would have this centralizing force where they don't want to travel for sex. They're happy to have everyone come to them, and they are happy to have them come to them at their house or at the bathhouse or at the club. But either way, they've got to have the partners come to them. That's our thinking on it. So in a way, they could be like a local super spreader if they were to become infected. And from a geographic pattern perspective, they would sort of, let's say they lived near the village, they might have all their partners come to them at home, but then when they go to their gym, they have sex with a lot of the guys at the gym. And then when they go to the bathhouse, they have a lot of sex with the guys at the bathhouse. And so they can end up having this very Tillering kind of looking network. And in terms of how would they fit into this sort of web of partnerships that might be possible, it's unlikely that a siren would meet another hoster or another siren, unless they both happen to be at the same bathhouse. But even then, one might not want to get up and move over to the other one. I don't know. They are, so they're unlikely to meet them. They're likely to partner up more with rovers or travelers or privates and geoflexibles and house callers instead. So I think we've probably talked about these enough. That hopefully you're starting to get the imprinting of these ideas. So the hosters, centralized sex environment, but potential to spread STIs widely. House callers have a more dispersed sex environment with a potential for mid-range dispersal. The rovers have a more local sex environment. So a centralized sex environment versus a local sex environment, kind of we're thinking about them differently. So where the rovers are likely to spread locally, and the privates are more of a highly localized sex environment with some rare travel, but they have the potential to bridge out to the suburbs. So they're more of a local spread, but bridging out to the suburbs. And then the travelers have a dispersed sex environment with the potential to bridge partners locally and globally, even though they have fewer partners. And the geoflexibles have a very dispersed sex environment but still in a, well, mostly in a local sense, but also in a global sense. And the geoflexibles are the most flexible of the archetypes, with the potential to bridge the most subgroups, because they have a lot of partners, and like we've already talked about. Whereas the sirens are almost like a completely different type of person or archetype, where they have sort of multiple highly centralized sex environments with the potential for local spread. Okay, so I want to give a caution that all of this has been, so the act of sex is time varying and time dependent, right? So we're taking sex and adding a location in space and time for it. So we needed to limit for a mapping perspective, we needed to limit the act of sex to a single point that was comparable across all these men. So we took specifically the first time they had sex with their partner, which may or may not have been, and we can argue whether that's the best time point or sex event to use. We used it because we wanted to be consistent across, and we also, because then it's a little bit easier to compare, we also figured that the first time a person has sex with a new partner, it's one of the riskier times. It's the chances of STI transmission are generally higher than other times in the relationship. And it's a memorable one. So usually people can remember where they had sex, either the last time they had sex or the first time they had sex, and everything else in between kind of can become a bit of a wash, right? So we kind of thought, all right, it's a riskier time point, and it's memorable, so we used that. So all of this is based on the first time somebody had sex with a partner. We don't know if that holds true throughout, like if that first time is representative of where they're going to have sex all the time, or we don't know. So that's future work that needs to be done, is how well does this hold up when you choose the time that you most frequently have sex with somebody. In terms of, the advantage though is if you only have sex with somebody one time, then this is a really good time point to use. So, which in a lot of cases, that was the case for these men. A lot of they often only had sex once with a partner. So it would be good to look at most frequently and most recently as well, I think, and maybe there are some other points in time or events in time that you could use. It would also be good to do a quantitative study of a larger sample of men, because again, we've only got 31 guys. We've split this up really thinly to start getting an idea of whether or not, like, okay, so geographically we can see archetypes, but are there actually characteristics to these guys? And then, as Devaki said, like, one of the things I'd like to start doing is looking at the psychology somewhat behind this a bit. So, like, if we were to look at personality, do hosters have a different personality from, in general? Can we generalize compared to hosters? Are one of them more introvert and the other more extrovert, or one's more neurotic or one's more open? Those kinds of things. So it would be interesting to see if that's influencing these distributions and how far one's willing to travel. Attachment style might also influence it. If I'm, a people pleaser because I have an insecure attachment style, is that going to influence how far I'm willing to travel? Those kinds of things. We also want to figure out sort of the generalizability of these. These are just proposed archetypes at this point, so it'd be nice to know, do they hold up under a larger sample? We've managed to, at first I thought it was 3, then I found out it was maybe more like 6, and then eventually when we looked a little further it was 7. Maybe there are more, like this, maybe there are more. So it'd be good to see, just do these, and do this, or maybe none of this is, maybe this is just a really fluke incident, but I don't think so. Also, a larger sample would help us characterize further some of these archetypes and see if there really are ways to sort of, almost like in mythology, like, because then if you know more about the sort of the characteristics of the archetype, it'll help you understand how to intervene with that archetype. If you know that hosters are introvert and they're not going to leave the house to have sex, then you might target them with different messaging or different intervention altogether from a rover or a geoflexible or something like that. also, a larger sample would start letting us look at measuring associations for different things. And it would let us figure out if there's actually any practical evidence for the 7th archetype, which right now is only theoretical. So, at least in Toronto, the gay and bisexual men who have sex with men had little regard for syphilis, at least the ones we talked to, mainly because of an overwhelming concern for HIV and a lack of awareness of the outbreaks or symptoms of syphilis and its treatability. The spatial architecture for these egocentric sexual networks suggested that there were 6, maybe 7 specific archetypes that could be identified. But the hosters and rovers, they may comprise the core group as opposed to core area. So maybe we're working more with a core group of transmitters or 2 core groups of transmitters that actually, because these guys aren't actually going to encounter each other, we might actually have 2 core groups of transmitters, which might explain why, again, we're not getting on top of this thing. That these groups were not geographically isolated to core or non-core areas. They're actually everywhere, these archetypes. And that could explain the syphilis transmission outside of the core areas and between core and non-core areas. The hosters and rovers are not likely to encounter each other, but could be bridged by the geoflexibles. And hosters and rovers could be priority groups for syphilis prevention and intervention. If you know that's who's carrying the burden of disease, then maybe that's who you want to focus on first. And it actually wouldn't be that hard in a clinic setting to start figuring out who's a hoster and who's a geoflexible. You can ask pretty much 3 questions, like what proportion of your partners do you have sex with at home? What proportion at your partner's house, and how many elsewhere? So it actually wouldn't be that hard to figure it out. So these are probably what I would suggest would be priority groups for intervention and prevention. And I think they'd be open to intervention and prevention activities because they already are at 100% both groups for STI testing in the past year, so they're getting tested, and so maybe they'll be open to it. So that's what we've been doing. Thank you for listening.
Hi, I'm Melissa Habel. I'm a health scientist in the division. Great presentation. We had done some work with the syphilis outbreak in Portland, and we had seen that a lot of the men who reported having syphilis had attended group sex parties. And so since it looked like your hosters had high numbers of sex partners, I was wondering if you knew whether they were actually hosting group sex at their homes.
Yeah, that's a good question. For our sample, I don't think they were hosting sex parties. They were just hosting sex. But yeah, it kind of makes me, we didn't capture those men, and it would be interesting to see if they would be exclusively a hoster or if they would be that 7th archetype of the roving hoster who's going to host sex at their house as a sex party, or if they find other places where they're going to host sex parties. The sex party aspect is a big one. I know that there are certain people who are sex party planners, and they will set up tables and testing and everything. So it's an important group to think about in terms of transmission for sure.
Hi, my name is Ian Spicknell. That was a great presentation. I have a number of questions I could ask you, but I'm going to limit it to one. And so I'm hoping you can expand on an idea that you brought up very briefly about, you're talking about certain of these archetypes had fewer partners, but they had to travel a longer distance. To me, that implies there's some sort of budget or utility function thing that's going on in the background, that like, if I don't have to travel anywhere, I can have sex with a lot more people. But if I have to travel, there's only so much time in the day, so I'm going to have fewer partners. Did you look at that more?
Yeah, that's a good question. No, that's probably something we need to explore a little bit further, is how are they getting there as well, and why do they have fewer partners? I mean, we can speculate that it was mainly the house callers, I think, that there were a larger number, like they were a larger proportion of the sample, but they only had 3 or 4 sexual partners. So they were traveling and potentially traveling fairly far, but they just didn't have a lot of sex partners. Now, we can't comment on whether or not they're having a lot of sex either, because we didn't ask how many times did you have sex with this partner. So there could be a lot of different reasons why they're doing it. So we did speculate that they're not having sex at home because they either have a partner at home or they have parents or roommates or something like that. So are they investing in, the other question is what's the type of partner that they're going to see? Is it a regular partner, or do they invest in sort of 3 or 4 regular partners that they can sort of travel to whenever they want to, or are these one-offs where they just hook up? It's a really good question, and it needs more work for sure to talk to these guys and figure out. So how come you don't have so many? I mean, you may not frame it as how come you don't have so many partners and the hoster has a ton. I actually think it could be like if you think about the hoster has a ton of partners and it's just a few house callers there. I mean, it could be that there's saturation of the possible sites, I guess, too, in that sense. Yeah.
Hi, yeah, great presentation. I'm a behavioral scientist in the Division of HIV/AIDS Prevention. So I was curious if you considered how the apps display people who are close to you, and then if you pay more, they will expand the distance and you increase the number of available partners to peruse on the app, and how that might impact some of your distance findings.
That's really good. We haven't thought about that at all. Yeah, we just, we own, because certainly the hosters there's at least 2 groups that are finding most of their partners online.
Yeah. Okay.
And the hosters, we don't know, oftentimes the hosters don't know how far their partners, like where their partner's coming from. They just know that they found them online and that they're coming over. So that would be a good, I don't even know how we would look at it, but it would be a good thing to start considering in these travel distances, because it would influence whether a hoster is like drawing locally versus like over a much larger catchment area. It would give us a sense of how large the catchment area is for each of those hosters.
Right.
Yeah, that would be really good to look at.
And my second question, if you can go back to the demographic slide.
Sorry, there's like there's a lot of animations in this. I like to do the slow reveal. Okay. Like this one?
The one with the STIs.
This one?
Yes. Okay, so I was curious about, given that where someone lives and the advent of these apps, blah, 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 and it's all temporal, right?
Yeah.
So I was curious about why the STIs were looked at as ever.
Whether or not somebody had ever diagnosed with an STI?
A more recent.
So this one was really exploratory, and we kind of wanted to know. We weren't sure that with this low number that we would get if we just said, okay, in the last 3 months, give us your partners and your STI status. We were like, oh, we'll probably get no STIs, but that might not be true in the sense of like, we might all of a sudden have a group of men that look like they have no STIs, but they might have some kind of history, whether it's in the last year or the last 5 years or the lifetime. So we kind of ended up going with lifetime, which, again, not ideal. But we also weren't testing them, and we just kind of wanted to it was really exploratory, just like a general sense of who out of this group might have a history of syphilis is ultimately what it really came down to. And then it was like, well, if we're going to ask them about syphilis, let's ask them about the other STIs as well. So it became lifetime for all of them.
Awesome.
Yeah, thanks.
Thank you, Dionne. That was wonderful. So I have a lot of questions, but I feel like it's not appropriate to ask them at this stage because you're dealing just with the first sex, right?
Yes.
What happens the second time, third time, etc. But still, I'll ask them because maybe you have some insights.
Maybe you have some
I
ideas.
don't know. So I'm hoping you're going to get more funding and you're going to look at the second, third, whatever, follow this line of thinking. But one question is, since you have done a lot of conceptual work on this, what is your conceptualization? Could all of this have to do with developmental phases? could it be that young men start out as one thing and then become one archetype and then evolve into other archetypes? I would love to hear your thoughts about that. And the other question is more demography, more sociology. How are they spread socioeconomically?
Mm-hmm.
How are they spread in terms of age? Are the younger ones more likely to be house callers? Older ones more likely to be hosters? And does that have anything to do with income, with the glamour of their digs or whatever?
So these are great questions, and we've been thinking about them a little bit also. I think it would be fascinating to see if somebody's archetype changes over time and their relationship status or their life stage, those kinds of things. I think that will be really interesting to see if that changes. Also, to see if it changes by season, because at least in Canada, like, season's a big deal. So you're not having sex in a public park in the middle of winter unless you absolutely have no other choices. So you may be a rover in the summer, but you may absolutely be not a rover any other time of year. So season, over time, over age. Also, if you look at, sort of from getting to your demographic question, so for the hosters, they were the oldest group. They're also I think they're the old white guys who historically have had all the sexual power, and they haven't had to really do anything. They've been the prize, and so they can just have the guys come to them, and they don't have to really work for it, or at least it's in a different way. Whereas your rovers you're talking about, the majority of them are not white, and they may have a totally different. So from the more qualitative analysis that we're doing, there is this question of, at first, what we asked was, how do you find sexual partners? And what started to emerge was this issue of aging and who's got resources and who doesn't have resources. And the older men are maybe losing their looks, but they have access to a car, which out in the suburbs, if they have to travel to the young hot guy who can't have sex at his house because he's still living with his parents, so he says, bring your car and we'll have sex in your car, then that becomes the exchange of, like, the young guy has youth and beauty and the older guy has resources and he's willing to travel. And so, yeah, I think you're going to see these proportions might change over time also as the older men move on and the younger men become the more dominant group. You may see a whole shift in the proportions of these. I think the underlying piece is this concept that my psychiatrist community or partner, collaborator has been talking about, is this public versus private space and where you have sex. Do you have sex in private or do you have sex in public, or both, and how those break down into these different types. But I think you'll see differences. Yeah.
Star 6 on the phone. Do you have a question?
Hi, thanks.
Yeah.
I was wondering if in the interviews the participants ever sort of, in the way they talked about themselves, actually affirm any of these archetypes. Did they actually say, "Oh, I never have sex outside my house"? You know what I mean? Like, or was the archetype really derived entirely from the mapping? You know, or was there some evidence of the archetypes even in how they talked about their sex partners and their sex lives?
Yeah. So I'm going to give you the long answer, which is how the thinking on this has kind of evolved for me. So for me, it started with looking at geographic profiling, which is used in the criminal world to figure out where, like, a multiple offender is spatially located based on their crimes. Now, not that sex is a crime or that kind of thing, but this idea that there's, in geographic profiling, they talk about hunting grounds. And in many ways, you could think about sex in this sense of predator prey and hunting grounds, and what are your hunting grounds for sex? And so can we start to use that idea of, well, maybe it's possible to profile people and know what their hunting grounds and practices are. So it sort of started to evolve that way, and so then it became maybe we should map it. And then actually hosters, that term even actually came from not just the participants, but what you see online. So there are a lot of guys who will actually write in their profile, say, I can host sex. And so that kind of became the first label for us was, oh, okay, well, maybe maybe these are those guys. They're hosting sex. They're hosters. So we'll call them hosters. And then it became, okay, but then there's these other guys that are only going to their partners' houses. So what do we call them? Well, they're kind of like house callers. So we'll call them house callers. And then it was a question of, well, what do we call these guys that don't go anywhere? They only go to a third place. And so we actually had to use like a dictionary to start figuring out like what are the different options. And then I actually used to call the privates homebodies because with the idea that they only have sex at home, whether it's their home or their partner's home. But one of my collaborators said, don't use homebody because that's already got a sense to it that's like, that'd be more like the hoster. And then, so we were like, okay, well maybe privates is, after some discussion, we decided, okay, privates is the one because they want to have sex in private, whether it's their house or their partner's house. And then it took a while to figure out. Geoflexible actually was a hard one. That's another one that I sat with one of my students and we thought for a long time about what's really going to capture the flexibility in the geography of their sex. And then we just took geo and flexible and stuck them together and came up with geoflexible. So I guess this is a long way of saying the only one that I can say has been confirmed, or I feel is like confirmed by participants and the community as a whole would be hoster. And then after that, we've kind of been building the names over time and thinking about probably way too much. In some ways, we might be torturing the data as we think about this very conceptually with some evidence to sort of support it.
This is really fascinating to think about, and I don't think I actually have questions that you can answer as much as like comments that are in my head. But I found it interesting that so few men knew anything about syphilis, but so many men tested, which made me wonder if they actually had been tested for syphilis in the past year. And then also what's driving them for testing. Are they going because they're like taking care of themselves, or is it because of they're having symptoms or they were notified that they need to get tested, which I think would be important in terms of, how we communicate with them. And also for future, when you're looking at this, if you do this with a larger sample and collecting that information to know, why they're going in. But then also from a communication perspective, there's been kind of this movement in the marketing world to look at populations not by demographics, but kind of with these different archetypes. And a lot of the times we do it around music. So, there's like a demographic that kind of falls into like a hip hop, category or a country, and there's values associated with it. So when you go in, they've done this with tobacco, where they, you want to promote not smoking, and you can really tie into, for some groups, that you don't want, like the big business who's trying to take your money or trying to get you hooked on cigarettes, and that's enough of a motivator. And I'm wondering, as you're talking about these archetypes, if there's some of those kind of values as well that we can then use to reach them, whether it's for interventions or to increase awareness and knowledge of a syphilis in an area.
Yeah, these are all great points, and for the most part, we don't know anything in depth yet because I think they need a lot more exploration than what we did, and we still need to analyze our data further. Okay, so the idea of the different music groups and the different sort of interest groups, like the subgroups, that's actually something I was talking about earlier today. This idea of subcultures within the MSM community. I mean, you've got the guys who are really interested in being fit and wear body image, and there's like a lot of body stuff there, who are going to be very different, and how you speak to them might be very different from the bears, and then the bears might be very different from the guys who are like grandmothers. Like, there's a lot of gay guys who are like grandmothers, and they're going to be different again. And so, the messaging, it would be really good to sort of figure out, like, can we further characterize? The more we can characterize these, if it's possible, then the more we might know about how to better tailor interventions and messaging and testing and treatment. As far as knowledge of syphilis goes, a couple of the guys, and I can't remember how many of them now, but at least 3 or 4 of them had been tested for syphilis and tested positive within the past couple of years. And what I have not done yet is matched up whether those guys still knew nothing about symptoms. Like when I say like overall they didn't know much about syphilis and STIs, I haven't actually gone in to check and see, is the guys who actually say they have a history of it that also don't know anything, or are they the ones that actually do sort of know something? And that's something I haven't done yet, but needs to be done. Because, I mean, it would be really strange, wouldn't it, if guys who are testing positive for syphilis still don't know the symptoms or aren't getting tested regularly. And I think some of the guys have HIV, and so they might be getting tested regularly because of the requirements for HIV treatment. Motivation for getting tested, we did not ask about on during these interviews, but it is something that we're going to ask on a larger survey, and we're going to do a bit more work around testing because I think that one's pretty important.
Just a couple, one observation and a comment. It might be, I assume you're going to get a lot more behavioral data or have some, for instance, condom use, positional pieces that would fit in with the archetype, certainly,
yeah.
In describing psychological and behavioral types. So that would be really interesting. And in thinking of the archetypes more on a sort of Myers-Briggs than a Jungian kind of perspective, where you've got just a whole lot of different cross-cutting factors that create these different archetypes. The second comment is that the way you're presenting them, although I mean you're clear in that it's not 100%, the hosters have a 10% possibility, or it's possible that 10% of the time they are
house
callers.
They're going
10%
somewhere
of the time they're house callers, or that the house callers 10% of the time are their hosters. And from what we see in networks, I mean specifically thinking of the Rockdale County network, that 10% can be the difference between an outbreak and success and failure in controlling an epidemic. So in some ways it seems like you need to capture the 100%ers, and then I don't know that the 20% is the best cutoff.
Yeah, so it's a good point about the cutoff. So we used 80%. We used the data to drive that threshold, because there were some guys that only had 3 partners. And so if 2 out of their 3 partners were at home and one of them was elsewhere, then we were like, okay, we don't want to call them just a hoster by using a lower threshold, and we don't want to completely disregard it. What was it? Anyhow, there was something to do with the distribution of the data, so that 80% kind of became the sweet spot for these data. But going forward, if you had a much larger sample size, you would be able to get a lot closer to 100%, and use that as the threshold instead of 80%, because you have the numbers to do it. It essentially came down to how to classify them in a way that best represented what we thought was going on with the guys here. But yeah, it's a good point. I still feel slightly uncomfortable even using 80. I would have preferred to use 90, but there would have been cases where people would get kind of put in the wrong place when you look at their map and you look at their other stuff. Mostly it was the map, and yeah. So it's definitely, this is not a hard and fast rule yet. Yeah.
I had a question. When you talk about where people are having sex, it's only the first time they had sex?
Yeah, for this.
So if someone had 3 partners,
mm-hmm.
it would have to be 100%. It couldn't be 80% if you had only 3 partners, right? So then it's either 66, 33, or 100.
Right.
Yeah. So then my question is, it seems like if you're going to use this for any kind of prevention intervention, it seems to me you'd want to know that these are consistent people are consistently in this type.
Yeah.
So you'd want to know not just the first time they have sex, but all the time they have sex. So if someone's a hoster just the first time, and after that they go to other people's house, they do all these other things, and it's a really different situation from they're always a hoster. So have you talked to people about other partners besides, or other times they had sex besides just the first time?
No, not for this study. So this was just exploratory, like let's put our toe in the water and see what we can find out, if it's even possible to start seeing if there are profiles that could be identified. And then it's definitely one of the limitations of this is that we've only asked about first sex. And it's also, it's a good question around like, so over time do people's archetypes change? Right. Over relationship, does it change? So like maybe the first time you have sex, until you become like a regular partner, maybe you're only having sex in a public place or just at your house or whatever. Does it change over time by partner? There's like a whole mess of questions around like how stable is this?
Right, in order for it to be a type, it's got to be stable somehow. It can't be just chance.
Yeah, and so then the question is, if it changes over time, is this useful still or not? And then in my mind, I think it could still be useful in terms of what you're telling people about the first time they have sex. Like, what do you have to do to keep yourself safe when you have a new partner? But it's a good question of like, and would you need to know about every time they have sex? Like, should we be asking rather than partner, where are all of your sex events happening? So detach it from partner and just make it about the sex act itself. There's a lot of different ways you could try and look at this and start saying, okay, is this stable? How stable is it over these time varying, the time varyingness of sex?
There's so much to discuss. This has been so stimulating. And we do have another hour, not anymore, because we have eaten up 25 minutes. But please stay around. Let's do the circle format. And but I think we have to formally bring the lecture. So thank you.
Thank you. Don't disconnect this part. Okay.